Hi, my name is Dr. Joseph Yazdi. I'm a board-certified neurosurgeon with over 20 years of experience. My goal with this video is to provide a complete reference guide for you about your surgical procedure. I will explain to you why and how your surgery is performed, review the risks and benefits of the surgery, and other treatment options to consider. We will also discuss your post-operative care. I hope that this video will be a recreation of your office visit and a good reference guide for you, your family, and your friends. The typical reason you're seeing me for a dorsal column stimulator is because you're having chronic pain and dysfunction. You've already tried physical therapy, you've already tried chiropractic, you may have even tried previous surgery, and nothing has really helped, and you're still very limited in your ability to do the things that you want to do. The way it works with the dorsal column stimulator is that it's a two-part process. The first part is a trial so we can actually make sure you do well with it, because the permanent implant will give you about the same result. Both the trial and the permanent surgery are done in a surgical facility. The trial is done with you under sedation and not general anesthesia. It is done through two needles. The needles go through your skin into the spine, and through the needles we pass two wires up into the spine. And you can see what they would look like when we're done. When the wires are placed in the right location, the other end of it comes out of the spine and goes into a battery that's attached to your side. We will keep this system in you for about 6 days. We want you to get up, move around, do your normal things, and see if the stimulator is going to help you achieve a much better function and a lot less pain while doing so. If it is successful, when you come back and see me in the office 6 days later, we remove the entire system and then we plan for a permanent implant. The permanent implant is done with you under general anesthesia. Instead of the wires, we will put a paddle lead, such as this one, where all the electrodes are embedded into the paddle. We would know exactly where we need to put the paddle based on where the stimulation helped you the most during the trial. To put the paddle lead in, we will make a small incision and open up a window inside your bone here so we can have access to inside your spine. And then we slide this into your spine so that it ends up in the same position as your trial electrodes were. The other end of it, instead of coming out of the skin into a battery, actually gets tunneled down into your butt cheek area where the battery is going to be inside you. So what are the risks of surgery? There is risk of bleeding and infection just like any other surgery. The other risks are all related to working on and around the nerves. Those include weakness or paralysis, numbness, loss of bowel and bladder function, and that surgery may not resolve all your symptoms. The chances are low, but never zero. Additional risk to this surgery is that if you bend more than the recommended amount, you may actually pull either the trial electrodes or the permanent implant out of place, in which case it would require return back to the surgery suite for replacement of the device. You will typically be discharged home within a few hours from surgery. As for post-operative instructions, I would like to keep the dressing on and dry for the next 2 days. Then you can remove it and take a full body shower. But I would like you to avoid taking a bath or soaking it in a pool. I want you to keep lifting less than 10 pounds. You may walk or go up and down the stairs as long as you're comfortable. I will see you back in the office at 2, 6, and 12 weeks from surgery, and we will get x-rays periodically to make sure that everything is not only in good position, but that the healing is coming along as expected. You may get some physical therapy or chiropractic treatments after surgery. It will depend on a number of factors that we will discuss. Most patients typically go back to light duty work at 6 weeks and heavier work at about 3 months.